I'm Iftekhar Sharaf Ahmed. I'm a fourth-year PhD candidate at Purdue College of Pharmacy. I have received the 2024 PhRMA Foundation Award in the Value Assessment and Health Outcomes category. I first got interested in research during my first year of pharmacy school. I really enjoyed learning about how medications work and how they affect our body and their benefits and harms. But I wanted to do more than just read about them in textbooks. I wanted to get involved in the process that is used to understand how medications work and how they benefit us as well as harm us. My research involves patients with dual diagnosis of opioid use disorder and depression. In the United States, we are all familiar with the opioid epidemic. Approximately 1.6 million people have opioid use disorder, which is a leading cause of mortality. To complicate things, nearly 1/3 of patients with opioid use disorder also have depression, which leads to even worse health outcomes. To give you an example, buprenorphine is the medication that is used to treat opioid use disorder. However, people who also have depression are more likely to discontinue buprenorphine. In other words, depression makes it really difficult to successfully treat opioid use disorder. And people who have depression, in addition to opioid use disorder, are at higher risk of opioid overdose, opioid use, mortality, hospitalizations, and other adverse health outcomes. My research goal is to investigate if prescribing antidepressants, in addition to buprenorphine, increase the likelihood of successful treatment of opioid use disorder in these dually diagnosed patients. Specifically, we are investigating outcomes such as retention to buprenorphine therapy, opioid overdose, opioid use, and mortality. My research will hopefully demonstrate the clinical benefits of antidepressant therapy in addition to buprenorphine therapy in these dually diagnosed patients. And we also hope that our study will inform clinicians on the effective management of opioid use disorder in patients with depression and opioid use disorder. So the PhRMA Foundation Award was the first time I received any external funding. This has been a source of huge motivation for me. This has given me the confidence to pursue research funding in the future. And I also feel like when I will apply for postdoctoral positions as well as faculty jobs, this will bolster my application and improve my chances of success. A standout moment from my research journey so far has been my first successful research project, which was a systematic review on antibiotic resistance. So essentially, this was the first research project that I planned, designed, implemented, and published as an undergrad student. And this was a very challenging and high-risk study because I was very new in this area and the learning curve was very steep. This was like my first step in becoming an independent researcher, and also that was my first step into epidemiological research. And after that, I have published more papers, but that first paper has still been the most cited paper and the most kind of recognized paper that I have published. My advice for other early career researchers would be to explore various research areas before committing to one specific field. And I recommend undergraduate students to study different fields, different papers, volunteer in the labs of various professors. And I feel like that is the only way to find out what somebody is truly passionate about. My future career goal is to work in academia as a professor. I have always been excited about science research, and I feel like being a professor will allow me to pursue my interests and my passions. My long-term goal is to improve the health outcomes of patients with psychiatric conditions and substance use disorders. I also want to contribute towards the advancement of pharmacoepidemiology as a field. It is kind of a new field, but it's growing really fast and it has shown lots of potential. And I want to be a part of this exciting journey.